but typhoons is usually of as osteoarthritis. Definition: osteoarthritis show inflammation. They result for chronic health. Arthritis can be a headache and injury for trans disease. Common sport of osteoarthritis influence they affect dogs. Definitions.
Normal joints are made of two bones held together by ligaments and tendons, which are thick bands of elastic connective tissue. The surfaces of the bones are covered with a semi-transparent layer of connective tissue called cartilage, which is elastic and flexible. Cartilage layers contain no nerves or blood vessels. Thus, injury to the cartilage does not heal quickly. The main function of the cartilage is to cover the surface of joint bones, allowing smooth movement of joints and preventing the bones from wear and tear. It also acts as a shock absorber, preventing the bones from injury during movement or impact. The muscles attached to the joints also act as shock absorbers and help in keeping the bones together, as well as generating the force needed to move the joints.
Application imaging.
I manage my life. I have a better understanding of the condition from a biological standpoint, medical standpoint. I have a good understanding of healthy options of physical fitness and a dietary good sense and how to manage my pain.
With osteoarthritis, pain results from changes in the joint, including loss of cartilage, the addition of bony overgrowths or bone spurs, and inflamed joint tissue lining.
Our bones are rich with nerves and blood vessels. Cartilage is like a cap that protects those nerves and blood vessels. As that deteriorates, then you have the bone on bone, you have those nerves against each other. That's the pain you feel.
Acute pain is generally intense but temporary. It's nature's way of telling you to stop. The pain usually leaves when injury or disease has healed.
Cause primary onset and for now resultant for influence of this emergency result and more against the ice weeks and get what they increments and they protect mancave of architects the generation ever young cartilage and they became for midday in Avedasek aesthetics there is total wounds costumes wigs they bones and joints.
egg.com/osteoarthritis. Osteoarthritis, or OA, is the most common form of arthritis. This disease causes pain, stiffness, and limited movement of the affected joint. Along with damage to the meniscus, articular cartilage can wear away over time, causing a narrowing of the joint space. When this shock absorption is lost, and as the joint space narrows, bone can rub against bone, causing pain. These x-rays show the joint space in a normal knee compared to the narrow space in an osteoarthritic knee. When you stand or walk, the hip, knee, and ankle joints ideally should be vertically aligned, like stacked blocks. In an OA knee, the narrowed space and pain associated with the disease can often lead to an abnormal gait, which can throw off this natural alignment. The resulting misalignment is often associated with OA. Although both the lateral, outside, or medial, inside of the knee can be affected, the majority of people with OA have medial OA. You may compensate for this painful knee by limping to reduce the weight on that side of the body. Over time, knee OA can also lead to pain, instability, and stiffness problems with your knees, hips, and ankles. Knee braces can help restore knee alignment, particularly during weight-bearing activities like walking.
A balloon.
Hi all. I want to talk today about the types of arthritis and about the treatment. Many people are surprised to learn that arthritis is not just one disease. It's actually a group of over 100 related conditions, all involving stiffness or pain in the body's joints. And although we have a greater chance of suffering from arthritis as we get older, and the general perception is that it just affects old people. Around 60% of people with arthritis are under 65. The two most common forms of arthritis are rheumatoid arthritis and osteoarthritis. Osteoarthritis is caused by general wear and tear of the joints, leading to damage of the joints and the surrounding tissue. The elderly are most susceptible and are people who are overweight and those who repeatedly use the same joints. Symptoms generally include pain and swelling and ultimately an inability to use those joints. And rheumatoid arthritis is the most common form of arthritis, affecting over 2 million people in the United States. Around 70% of those are women. The exact cause of the disease is still not clear, although it's believed that rheumatoid arthritis can be triggered by various factors including inherited genes, female hormones, and the body's response to stress and predisposition to infection. Any of these factors can cause the body's immune system to perform poorly and for the white blood cells to attack membranes surrounding the joints, known as synovium. This breakdown of the immune system leads to inflammation and the swelling of the joints, and anyone with arthritis will verify. It can be extremely painful and can cause permanent damage to the joints and even death. There are various treatments available to help with the pain of arthritis. These range from an increased amount of rest, an improved diet, increased exercise, the application of heat and cold, and even surgery in extreme cases. A wide range of medications are also available.
Some people and for weeks and wonder they hate. They are realized to say where excuses are. They are I love. Quizás arthritis. After the quejando real abdominal. From how they had the bag safe separate. How this had suits of diabetes. And how deserve us all. Associated with high cartilage, we are scored osteoarthritis.
Rheumatoid arthritis and osteoarthritis, terms often used interchangeably, but in fact are two very different joint conditions. Generally speaking, arthritis can be broken into two broad categories: osteoarthritis and inflammatory arthritis. Rheumatoid arthritis is the most common form of inflammatory arthritis. There are some very basic and clear differences between these two forms of arthritis. They affect different joints. As you can see by the joints marked in black, osteoarthritis most commonly affects the hips and knees, the big toes and base of the thumbs, and the most distal part of the fingers, causing pain and sometimes bony enlargement. It is unusual for osteoarthritis to affect other joints. On the other hand, Rheumatoid arthritis can cause pain and swelling to nearly any joint, with typical joints being the proximal joints in the hand, wrists, and toes, in addition to all the other joints highlighted in gray. The pain or discomfort from osteoarthritis is typically worse with activity and improves with rest. Rheumatoid arthritis is the opposite, being worse with rest and better with activity. Many people with RA also describe being stiff in the joints for at least 1 hour in the morning. Who gets arthritis? Osteoarthritis is relatively common, occurring in approximately 10% of the population and increasing with age. While not entirely accurate, it is often thought of as being due to wear and tear. Rheumatoid arthritis, a disease caused by the body's immune system, only affects 1% of the population and occurs at any age. Genetics and smoking can increase your risk of developing either form of arthritis. While osteoarthritis is limited to the joints, poorly controlled rheumatoid arthritis can start to affect other organs, including the heart, lungs, blood, skin, and eyes. Because
Tranquilo.